Hello, everyone, and welcome to the first video in our mini-series, She Knows Her Health, presented by Zeta Phi Beta Sorority Incorporated, Gamma Alpha Zeta Zeta chapter. I'm Tashara Coakley, the chapter president, and I'm the host of this mini-series. And over the next 4 weeks, we will discuss pressing health topics, particularly for women, featuring experts in health and wellness. Since it is February, we're kicking off our series focusing on women's heart health in honor of Heart Health Month. Just a quick disclaimer, the information provided in this video is intended for general knowledge and informational purposes only. It does not constitute medical advice. It is essential to consult with your primary health care provider for any health concerns or before making any decisions related to your health or treatment. I'm so excited to be joined today by nurse practitioner Darlene King. She is a family nurse practitioner and she has been in nursing for 32 years. Thank you so much, Darlene, for being here and having this pressing health topic discussion with me.
Thank you, Dr. Coakley, for inviting me, and I'm so excited to be able to share on today.
Yes, exactly. So I know we both work in this health field, and so we enjoy being able to share this information with others. So I want to get us started with some heart health facts, and I know you had some facts and some statistics that you could share with us. So let's start there.
Okay, so heart disease is the number one killer of women. It claims 1 in 3 lives each year in the United States. So 1 in 3 women die of some form of cardiovascular disease in the United States every year. And that's more than all of the cancers added up together. More women die from heart disease. Pregnancy and menopause actually puts women at an increased risk for developing cardiovascular disease, yet only half of the women before entering into a pregnancy state has optimal cardiovascular health. So that really increases the risk tremendously.
Those are some important facts that you're listing off there, especially, again, since we're focusing on women. And then in particular, pregnant, that I did not, have that information here, in my stats, but that is good information to know for women that are thinking about getting pregnant or are pregnant to have this heart health information. So you speaking about the facts, of course, I want to know, and I'm sure everybody else want to know, what are some of those risk factors of heart disease that we need to pay attention to or need to be aware of as we're, getting older or as maybe younger, but just need to know what those risk factors are.
Okay, so some general risk factors, of course, are increasing age. As we get older, we are at an increased risk of developing cardiovascular disease. In addition to that, smoking, stress, not having good stress management, unhealthy diets, and lack of physical activity also puts us at increased risk of developing cardiovascular disease, in addition to having hypertension or diabetes. And especially if those two conditions are uncontrolled, it would put a person, and especially women, at an increased risk of developing cardiovascular disease. Now, there are some gender-specific ones that are specific to women, and that's if your menses started at an early age, specifically before the age of 12, contraception use, if your first pregnancy was at a young age. All of those things also puts women at increased risk of developing cardiovascular disease.
Oh, thank you. Those are some really good information to know about those risk factors. So, I heard a couple in there that sound like we probably could control, what's going on. Could you just give us a breakdown of some of those risk factors where we can make maybe some positive changes or some preventative actions so that we can maybe either decrease our risk of it or to slow down the progression of heart disease?
Absolutely. That's the best thing that we can do for ourselves. We can mitigate the risk by focusing on the risk factors that we can do something about. We can't do anything about being women. We can't do anything about being African American, which is one that I forgot to mention because African American women are at an increased risk of developing cardiovascular disease. So we can't do anything about those. We would think that we can't do anything about having hypertension or diabetes, but there are some things that we can do. We can decrease our risk of developing those two conditions. And in addition to that, if we do have those conditions, we can work right along with our healthcare providers to make sure that those conditions are controlled. So some things that we can do is have healthy diets. In this country, especially with African American women, we typically have diets that are high in saturated fats, high in useless calories, and low in fruits and vegetables and grains, healthy grains that we really, really need in order to help us maintain a healthy weight. So we can do something about our diet. We can eat better. Just remember that making changes, we can make changes one step at a time. And as we continue to make changes one step at a time, the next thing we know, we have overhauled our entire diets because we need to eat less meats. We need to eat at least 5 cups of fruits and or vegetables a day. We need to make sure that we're getting our whole grains. And when we do eat meat, we want to choose the leaner cuts of meat, and we want to try to eat a lot of fish, chicken, those types of meats, and kind of stay away from red meat as much as possible. In addition to that, we want to get exercise. We should be getting, according to the CDC, 150 minutes of moderate exercise per week. So we want to make sure that we do those. And I know that may seem like a lot, but you really can put that down in little bite-sized pieces. If you want to do 10, 15-minute sessions a week or 30 5 30-minute 5 sessions a week, whatever it is, just try to get in 150 minutes of exercise. Walking is good, so let's not discredit walking, because a lot of times people don't think of walking as exercise, but it is. In addition to housework, like running a vacuum cleaner, sweeping, mopping the floor, raking leaves. So we want to do as much as possible for the to decrease our risk as much as possible. And we want to try to stay out of the overweight and obesity category. If you have habits like smoking, you want to work on smoking cessation, and your healthcare provider can help you with that. There's different tools and measures that can help you with that. You want to decrease stress. So if you need to reach out to a mental health provider to help decrease stress, you want to do that. And you want to make sure you're getting adequate sleep. At least 7 hours a night of sustained sleep are all helpful in mitigating the risk that we have control over.
Oh my goodness, this is all such valuable advice. And if I could add, I would say don't try to do all those steps at once. But like you said, bits and pieces, even like with the exercise, try bits and pieces with that as those other steps. Like maybe you don't get the 7 hours now, but I know myself, I've been trying to like add up and get towards that and maybe decompress a little earlier than I normally do so I don't go to bed so late at night and then I know I have an early morning. So I think those are very valuable. All of that was valuable information. But I want to add to that as women, we can find an accountability partner, somebody to, maybe join a fitness class together, maybe set up family health competitions. Maybe you and the family, you all have step counters, or everybody now seems to have like a health watch or something where they're counting their steps. So make it fun, like you said, incorporating these things a little bit at a time. You won't even notice that you've made a quick complete overhaul of your health. And so I thank you for sharing those tips with us. So just to wrap things up, because you've given us a lot of information to think about and a lot of valuable information, what's the most important message that you want, us to take away when it comes to us thinking about heart disease?
I would say the most important, two things are the most important things. First of all, educate yourself. I believe that the more people educate themselves, the better that they do, and they become motivated to make changes. So educate yourself about heart disease, know what your risks are, and educate yourself on what you can do to mitigate your specific risk. And then the second thing is to do something. As we have both said, start off with small changes. I like to encourage my patients to do SMART goals. You know, pick one or two things that you're going to focus on and just say, okay, I know sweets are what's impacted me the most in getting into a healthy weight category. So kind of assess how many sweets you're eating and then just say over the next month, the next 2 weeks, you know, set something that's doable so that you don't get discouraged. And maybe say over the next 2 weeks, I'm going to decrease my sweet consumption by 50%. And then celebrate your successes. And then don't stop there. Set a new goal. And as you'll look back and you'll be able to say, wow, I have really did an overhaul of my diet. So just, you know, and you can do the same thing with exercise or whatever else it is that you personally need to do to mitigate and reduce your risk.
Yeah, thank you. Like I said, start small, right? And I like that. Set some goals, realistic goals that you know you can achieve, and then celebrate yourself. And it don't have to be. I know sometimes we celebrate with food, but maybe it could be you know you go out for a pedicure, or you know you get a massage, you know something else besides just celebrating ourselves with food all the time. Think of other things to do as well. Thank you so much, Darlene. I really appreciate you for sharing your expertise with us today. I really appreciate you taking your time. I want to tell the people how they can follow you because I know you have your own page as well as a business that you have started with doing things like this, sharing this information with the population that you serve now. So how can they follow you?
So right now, I'm only on Facebook, My MP Speaks. You can like and follow my page. I will be setting up pages on the other social media outlets shortly. And I will be available to come in and conduct seminars, do teaching, do health assessments, and all of that. So all of that information will be on my page, My MP Speaks.
Thank you again, everyone watching today. Thank you for learning about heart health. We encourage you to share this video with your friends and family, and then join us again for another She Knows Her Health video where we'll be talking about diabetes. And I'm sure that's the one that you have a lot of expertise in as well. But we want to be able to share that information with our viewing audience. Thank you again, Darlene. I appreciate your time.
And thank you again for having me.